Hi, good morning again. We are talking about a different lecture in this exceptional situation, and hope we can meet soon in a much more comfortable and nice periods as before, and to regain our natural life. Today we're going to discuss the filaria. Okay, what is the clinical picture of a filaria? I'm gonna discuss the incubation period, which is the pre-patent period actually. The incubation period in filaria, it's the time between the entry of the infective larvae into the skin and the appearance of microfilaria in the blood. It varies from 3 months to more than 10 years, okay, with some individuals remaining asymptomatic for life. Firstly, the acute inflammatory stage. The earliest symptoms are due to retrograde lymphangitis. Retrograde lymphangitis and lymphadenitis of the leg occurring in the lower half of the body. It's accompanied by recurrent bouts of fever, okay, which is called elephantoid fever, okay. These episodes are characterized by sudden onset of fever, rigors, sweating, and usually last to 2-3 weeks that can recur by frequency to 2 to 6 attacks per year. So there is a sort of recurrence. That's why it's a recurrent retrograde lymphangitis. The affected lymphatic vessel, as long as we are talking about lymphangitis, so we're talking about inflammatory condition in the lymph node and the lymph vessels. So the affected lymphatic vessels, since there is an inflammation, it's swollen, painful, with the overlying skin can be red, what's so-called lymphangitis. The additional common symptoms include the inguinal lymphadenitis, orchitis, hydrocele, and epididymitis. The chronic stage due to recurrent inflammatory conditions, so there may be a sort of irreversible damage or organization of the inflammatory exudate in the lymphatic vessel, leading to obstruction of the lymphatics. So, what's so-called elephantiasis? Elephantiasis, it is the enlargement of one or more limbs due to true outgrowth of the skin subcutaneous tissue, which result from chronic lymphedema. The leg and scrotum are most often affected. This is due to increased permeability of the wall of the obstructed lymphatic vessels, leading to leakage of lymph-rich protein under the skin, causing cellular proliferation. Okay, so this kind of edema is hard non-pitting edema. Hard non-pitting edema. Unlike the edema of the hypoalbuminemia, for example, which is soft pitting edema. As we're making the examination on the chin of tibia, both thumbs will be soft and pitting in case of hypoalbuminemia. But here, in case of elephantiasis, complicating the filariasis, we are talking it's hard non-pitting edema. Okay. Other complications and symptoms, it may be chylocele, lymphoscrotum, chylous diarrhea, chylous thorax. The chylocele due to rupture of lymphatic in the tunica vaginalis. Lymphoscrotum due to diffuse lymphatic varicosities affecting the scrotum, causing chronic weeping condition, lymphoscrotum. Chylous diarrhea and chylosositis and chyluria due to obstruction of the lymphatic of the bowel, leading to chylous diarrhea and chylosositis. Chylothorax due to obstruction of the lymphatic vessels on the pleural cavity. There may be bacteria on top, secondary bacterial infection, and bacteria cellulitis. Okay, regarding the differential diagnosis. Differential diagnosis, we are talking about the elephantiasis, the enlargement of the limb, the unilateral enlargement of the limb. So what's the differential diagnosis for a case of elephantiasis? Maybe infectious or surgical causes. Infectious causes may be due to recurrent lymphangitis, chronic bacterial lymphangitis, due to any other cause, chronic bacterial lymphangitis, recurrent erysipelas, lymphogranuloma venereum, leprosy, Kaposi sarcoma, mycosis, tuberculous lymphadenopathy. Maybe surgical causes like the deep vein thrombosis, surgical removal of the lymphatics, malignant lymphatic obstruction, traumatic, burn, chemotherapy, radiotherapy leading to the obstruction of the lymphatic vessels in the inguinal region, maybe leading to the same for the elephantoid tissue or the elephantiasis, which is the enlargement of the limb due to stasis of the lymphatics, of the lymph in the lymphatic, in the obstructed lymphatic vessels. Here, a separate entity, we're talking about the tropical pulmonary eosinophilia. It's a syndrome characterized by diffuse pulmonary infiltration, which may progress to chronic interstitial fibrosis with significant local and peripheral eosinophilia. What's the cause of tropical pulmonary eosinophilia? It's the Filariasis bancrofti. The Bancroftanian filariasis, it's the accused organism. The pathophysiology, actually, it's allergic in nature and related to the trapping of the microfilaria in the pulmonary vessels. Clinical presentation, constitutional fever, okay, and allergic condition, it's the asthma, and lymphadenopathy and peripheral eosinophilia. So tropical pulmonary eosinophilia, it's from its name. Tropical, because we are talking about an organism or filaria in the tropical areas and the sub-Saharan areas. Pulmonary, because it's affecting the pulmonary circulation, and the microfilaria are hiding in the pulmonary circulation. And regarding the eosinophilia, because one of the main symptoms is the eosinophilia. Pulmonary, so we are talking about the bronchial asthma and the fever. What's the diagnosis of such condition? Actually, chest X-ray, really having a diffuse interstitial infiltrate, okay, and rapid response to diethylcarbamazine. No microfilaria detected in the peripheral blood, and this is important, what's so-called occult filariasis. So, occult filariasis, it's the same nomenclature like the tropical pulmonary eosinophilia.